Hello, I'm urologist Omer Erdamakaya. Our topic for today is post-finasteride syndrome, and whether finasteride causes erectile dysfunction. We will have a short video about it. Finasteride was started to be used for prostate in 90s and for hair loss in 2000s. And after using it especially for hair loss in young males, caused some problems like erectile dysfunction, loss of sex drive, numbness in the head of the penis, lack of concentration, and anhedonia, which is inability to feel pleasure. It created a group of people who suffered from these problems. And some of those patients, even though they stopped using this drug, continued to have these problems. It came out that even though the hormones of the patients increased with androgenic treatments, their problems were not solved. Patients in this group are called post-finasteride syndrome group patients. Androgen insensitivity is thought to develop in these patients. It is thought that some areas of the brain develop insensitivity to androgens. Those areas are thought to be permanently blocked by 5-alpha reductase inhibitors. In fact, in the MRIs performed on these patients, the same findings were detected with patients with major depression in the brain oxygen circulation. We frequently use finasteride versus dutasteride in urology. Dutasteride is 1-2 inhibitor of 5-alpha. It is a stronger inhibitor than finasteride. When using this drug for BPH in my own clinic, I definitely question the sexual functions of the patient. Frankly, I do not recommend this drug if the patient has an active sex life, because it sometimes goes unnoticed in some 75-year-old patients. When we do not question their sexual functions and when we give that drug, the patient comes to me a month later saying, "Doctor, this drug caused some problems." Those who have this syndrome after using finasteride in America have established associations and foundations. This association and foundation, I think, could possibly be related to the future courts to create public perception. If we ask what percent of patients have this syndrome, it is said that 5% of the patients have according to the publications, but in some publications it is said that sexual function problems increase up to 30% in young patients using finasteride. Obviously, a patient who is willing to use finasteride may need to put sexuality on one side of the scale and hair on the other. Because if the patient does not want any sexual problems, he should not use this drug at all. But in terms of hair, it is really a very useful drug for genetic hair loss. It prevents the hair follicles from shrinking and decreasing. It can reduce the level of dihydrotestosterone by 60 to 70% in the hairy tissue. In fact, one of the important things is buying medicine from the pharmacy in our country as easy as buying bread from the grocery store. Patients can start using this drug based on friend advice. I think this is not true, and if the patient considers using this drug, at least a doctor who is experienced in this field can be asked about if the drug has bad side effects. Or if a person is considering using any chemical substance, he should definitely know the bad side effects as well as the good effects. The person also needs to know the risks to be taken. So, what can be done for hair loss? If a dihydrotestosterone-based treatment is considered for hair loss, saw palmetto can be used in patients. Saw palmetto reduces dihydrotestosterone. It also does not cause any problems related to erectile dysfunction. In fact, the medicine I use in my clinic contains nettle. In other words, when the patients come after 3 months, they generally say that the erection quality increases. It not only reduces dihydrotestosterone but also increases the erection quality. It also contains pumpkin seeds and lycopene. We usually get good results. But of course, it is very difficult to say whether it can be as effective as finasteride. Thank you for listening, best regards.